Good day, Virgin Islanders, at home and abroad, and welcome to the Government House Weekly Press Briefing on our COVID-19 update for the week of May 17, 2021. Joining me this afternoon is Dr. Esther Ellis on behalf of Health Commissioner Justa Encarnacion to provide the latest on the vaccine, COVID-19 statistics, and pop-up testing locations. But before we go to Dr. Ellis, I want to address an issue related to our pathway to normalcy. As many of you are aware of the CDC's recent decision to relax masking requirements for individuals vaccinated against COVID-19. While we have followed the CDC's recommendations and guidelines throughout our response, we are approaching this latest decision with a heightened level of precaution. Simply put, the CDC has not really provided clear guidance to states, local governments, and individual townships on how we make a visible distinction between the people who are vaccinated and those people who are not. It is an impossible mandate to enforce. Do we ask everyone not wearing a mask to prove they are vaccinated and vice versa? That is an unreasonable expectation for any government to be able to enforce. As one of the first jurisdictions in the United States to implement a mandatory masking mandate, as well as one of the few places in the United States with a COVID positivity rate of less than 2%, we know that masks are effective. And while we know that the travel portal and making available COVID-19 testing on a regular basis are also key contributors to our low positivity rate, removing the masking requirements and simply relying on the honor policy at this point is not something we think will protect our community against the spread of the virus. I would like to add that the majority of people that call this territory home, we're not talking about the people who come in here to visit for the weekend like guests in your house who are going back to where they live, they have not been vaccinated. Right now we're up at about 49% of individuals who qualify getting one shot, and less than that for people who actually have two shots. We're making progress toward our goal of vaccinating 50,000 Virgin Islanders. But we still have a long way to go in achieving the herd immunity that we know will keep our community safe. Even at this level of vaccinated Virgin Islanders, when we hit 50,000, we will still need more. We cannot afford to take any steps backward on our path to normalcy. We have to maintain doing the things that we know work in order to enjoy the benefits of that. The freedom of movement, the availability of tourists, economic progress, the continuation of our recovery. All those things are tied to us doing what it needs to keep you and your family safe. Before we go any further, we'll talk to Dr. Ellis, who's going to give us an update on what is going on. Dr. Ellis?
Good afternoon, everyone. As of May 17th, the Department of Health has conducted a total of 1,939 tests, of which 3,270 individuals have tested positive and 1,769 tests were negative. There are currently 63 active cases in the territory, 4 on St. Croix, 52 on St. Thomas, and 7 on St. John. 3,180 cases have recovered, with 27 fatalities related to COVID-19. From our hospitals, the Governor Juana Fleury Hospital reports 0 COVID-19 admissions. The Schneider Regional Medical Center reports 2 COVID-19 admissions, of which none are vented. Our weekly percent positivity rate is 1.54%. This is a dramatic decrease since the over 3% from last week. We must continue to get vaccinated and maintain other best practices such as hand washing, social distancing, and mask wearing. We are still offering pop-up testing, which is the rapid antigen test for anyone that is not vaccinated. We continue to test individuals who are sick or who have been exposed through our daily DOH drive-through on St. Thomas and St. Croix. We do not recommend the pop-ups for vaccinated people who are not sick. If you are vaccinated and need to get tested because you are experiencing COVID-19 symptoms, please call our hotline so that we can schedule you for our daily drive-through. The test we administer at the drive-through is the PCR test. Our surveillance efforts continue as our epidemiology team works to conduct contact tracing and case investigations. Our hotline remains open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspect cases of COVID-19. On St. Croix, the number is 340-712-6299. On St. Thomas, St. John, 340-776-1519. You can pre-register for the pop-up testing online at covid19usvi.com/testing. Here are our upcoming events. St. Thomas at Home Depot, Tuesday, May 18th from 1 to 3 p.m. St. Thomas at the National Park, Red Hook, Thursday, May 20th from 1 to 3 p.m. St. Croix, Canagata Rec Center, Tuesday, May 18th from 10 a.m. to noon, and St. Croix at Home Depot, Thursday, May 13th from 10:30 a.m. to 12:30 p.m. St. John at the Vipa Gravel Lot, Wednesday, May 19th from 1 to 4. Thank you everyone who has made the choice to get vaccinated. So far, 39,171 people have obtained at least one dose of the vaccine, which means that is 49.3% of our eligible population with one dose. 30,109 individuals are fully vaccinated. That is 37.8%. In total, 69,280 doses have been administered within the territory, and we are 10,829 first doses away from reaching our goal. We are making it easier to get vaccinated by bringing the COVID-19 vaccines to your community and other busy areas like businesses across the territory. Last week, we were in housing communities sharing information, providing education, and answering questions and concerns about the vaccine. We will continue to engage the community in this way. While being fully vaccinated is not a requirement for travel, it certainly does protect you while flying and also on vacation. It also makes traveling easier. Our current travel requirements can be found online at usviupdate.com. Some good news, an electronic vaccine passport is currently being developed for those that were vaccinated within USVI for use to travel back into USVI in lieu of testing. Until we have activated that, the electronic vaccine passport, it's important to remember that you still need a valid negative PCR or a negative antigen test or a positive antibody test to be uploaded into the travel portal to come into USVI. Other reminders. Last week, the community vaccination centers opened at new locations. They are no longer at the UVI campuses. St. Croix's Community Vaccination Center is now at the Nissan Center, which is in La Grande Princess, adjacent to the Honda dealership and the paint shop on the same side of the street as Foodtown. On St. Thomas, the Community Vaccination Center is now located at the Community Health Clinic on the second floor at the Schneider Regional Medical Center. The Community Vaccination Center on St. John has closed, but there are still options for getting the vaccine on St. John. Those are Island Health and Wellness Center, Inc. The number is 340-714-4270, or Cruz Bay Family Practice. That number is 340-776-6989. 6789. So I'll repeat that for Cruz Bay Family Practice, 340-776-6789. Important news, the Food and Drug Administration announced last Monday that children ages 12 to 15 years old are now eligible to receive the COVID-19 vaccine since the agency expanded its emergency use authorization for the Pfizer-BioNTech vaccine. The Virgin Islands Department of Health has adopted this new change, and we are pleased to say that children ages 12 to 15 can be vaccinated for COVID-19 locally as well. The Department of Health has reported almost 400 COVID-19 positive cases in children ages 0 to 17 years old throughout our outbreak. This latest development will lower the risk of children becoming severely ill with the COVID-19 virus. Deputy Commissioner Dr. Janice Valman shared her optimism for achieving community immunity with the recent expansion of the Pfizer vaccine's availability for children ages 12 to 15. In a press release sent to media partners over the weekend, Dr. Valman shared, quote, "I'm encouraging parents to make the choice to vaccinate their children against COVID-19. This pandemic has interrupted the lives of everyone, especially children, who have not been able to learn or socialize normally. This opportunity will help us get on the road to normalcy," end quote. Until now, only individuals 16 and up could receive the Pfizer vaccine in the U.S. Virgin Islands. In late March, Pfizer announced that clinical trials found 100% efficacy and robust antibody responses in study participants who were 12 to 15 years old. Parents or guardians with specific concerns or questions about their child's health should contact the child's pediatrician. The community vaccination centers on St. Croix and St. Thomas offer the Pfizer vaccine for this age group. To schedule yourself or your child for the vaccine, visit covid19usvi.com/vaccines or call 340-777-8227. Parents are asked to bring some sort of identification for themselves and their child or children if they are seeking to get anyone between 12 to 17 vaccinated. This is to ensure we have permission to vaccinate the child as well as to validate the age of the children getting the vaccine. With this announcement, the territory pushes closer to reaching Governor Albert Bryan Jr.'s goal of vaccinating 50,000 unique individuals by July 1, 2021. Recently, there was a major temperature excursion at UVI on St. Thomas where we store our Pfizer vaccines. About 1,750 doses have been determined unusable and were discarded. The Department of Health immediately took action and placed a new order. There was no interruption of services, and contingency plans for temperature maintenance are in place to avoid this type of issue in the future. On behalf of Commissioner Justa Encarnacion, I want to remind the public that COVID-19 guidelines and mandates established by the local government are still in place, despite the Centers for Disease Control and Prevention's latest COVID-19 guidance for fully vaccinated individuals. In the most recent guidance for fully vaccinated people, it mentions how people can safely resume activities, how they should approach domestic and international travel, and how they should approach isolation, quarantine, and testing. This guidance does not supersede local guidelines or mandates, and I want to once again remind the public to continue following the best practices for COVID-19 prevention outlined by the Virgin Islands government. Pursuant to Governor Bryan's May 2020 executive order, individuals 2 years and older are required to wear a mask when in any establishment and in public spaces when social distancing is not possible. Individuals and business establishments caught in violation of the mandatory masking guidelines will be subject to administrative fines and penalties. This applies to all individuals, whether fully vaccinated or not. People are considered fully vaccinated for COVID-19 2 weeks after they have received the second dose in a 2-dose series of either the Pfizer-BioNTech or Moderna vaccine, and 2 weeks after they have received a single-dose vaccine of the Johnson & Johnson Janssen vaccine. Currently, there is no post-vaccination time limit on fully vaccinated status. Unvaccinated people refers to individuals of all ages, including children, that have not completed any vaccine series. Because of limited data on vaccine protection in immunocompromised individuals, CDC recommends discussing the need for personal protective measures with their healthcare personnel, their healthcare provider, after vaccination. Fully vaccinated people do have a reduced risk of transmitting SARS-CoV-2 to unvaccinated people. Indoor and outdoor activities do pose minimal risk to fully vaccinated people. However, vaccinated individuals should still get tested if experiencing symptoms. They should not visit private or public settings if they have tested positive for COVID-19 in the prior 10 days or are experiencing symptoms. Continue to follow any applicable federal, state, local, tribal, or territorial laws, rules, and regulations. Outside of healthcare settings, fully vaccinated people can resume activities without wearing masks except where required locally. They can refrain from testing following a known exposure. They can refrain from quarantine if a known exposure occurs, if they're not sick, and they can refrain from routine screening if feasible. Whether fully vaccinated or not, everyone should follow the Department of Health's recommendations, and local travel requirements can be found at usviupdate.com. For more information on the governor's executive orders, visit vi.gov. The Department of Health and its partners continue to work together to fight the COVID-19 pandemic, but it takes all of us. To keep up with the latest information, please visit U.S. Virgin Islands Department of Health Facebook page or our website at www.covid19usvi.com. And for COVID-19 health information alerts, you can text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ellis. And I just want to encourage people to go out there and get your vaccine. It's available to you. Do your best to do that, and encourage other people to get a vaccine so we can get back to normal. In other related COVID news, I am pleased to announce that we have issued another 10,000 checks for the American Rescue Plan for the stimulus. That's totaling $23,371,000, courtesy of our Department of Finance and the Bureau of Internal Revenue. That is in addition to the 10,000 checks that we sent out the week prior. As promised, we are scheduled to make good on our commitment to complete the $1,400 stimulus payments to all eligible Virgin Islanders by the end of the month. Getting this money into the hands of Virgin Islanders like yourself is the most important thing for us to do, because we know that a lot of you are hurting and that you need it. A lot of the businesses have been impacted by this, and we want to make sure that we're giving you every single resource to make sure that we minimize the impact of COVID. As a reminder, today is also May 17th, which is tax day in the United States. It was postponed by a month, as everyone knows. So today is the last day for you to file your 2020 income tax return at the BIR without penalty. It also means that today is probably not the best day to call them asking them about your stimulus check. But tomorrow, you can ring their phone. Make sure you ask them about your refunds or anything else. Once we get these tax checks out, we'll be coming with another set of refunds, but we're trying to make sure that we get your stimulus checks out, rather, as quickly as possible. This week, graduates from our territory's public high schools will be receiving their hard-earned high school diplomas and trade certifications. I want to take this opportunity before we close this afternoon to congratulate each and every one of them, as well as their parents and families and the people that supported them over the last 12 years of education. I know there's been much conversation to date and even some civic demonstration by our young people concerning how our graduation ceremonies this year are being held. First and foremost, I can't express enough how proud I am of the class of 2021. How proud I am of their resilience and their resolve to continue even after two Category 5 hurricanes disrupted their freshman year and made more difficult the already challenging transition to high school. How proud I am of their resolve and their persistence to find normalcy in the throes of a deadly global pandemic that has now disrupted their senior year and the traditional celebration of this major milestone in their lives. Our educators, principals, and other officials who have planned, at the Department of Education, who have planned this year's commencement exercises, certainly have the best interest of making sure that the interests of the graduates, the students who did the hard work, is at their heart. They have done their best to put forward meaningful celebrations while remaining in compliance with the protocols instituted by me, as well as the Department of Health. And that has not been easy. Over the last year, we have all had difficult decisions to make. And last year around graduation, it was the same exact type of demonstration and a lot of complaining. But we had a beautiful virtual ceremony. And most people were impressed. I know I was duly impressed at the quick, efficient, and really respectful way that the Department of Education has graduated our youngsters. When I'm talking about our youngsters, I really want to congratulate the parents and the teachers and the familiar support that have created all these beautiful young Virgin Islands people. I was so impressed by their call to action, and they're exercising their right to peaceful protest, very organized, and making sure that their point was heard. They went further and wrote to me pleading. Several of them wrote to me pleading for the cause. I remember one particular email where the student was talking about the extreme stress that the last year has put on them. They were a good performer in school, really did well in English, but doing the subject remotely really was a problem for them. And especially in your senior year where everything is supposed to be pretty much easy, you got this wrapped up, you're just trying to get to school. They really expressed how the mental health of our graduates, our students, is really being affected. And I wrote her back too, and I said, you know what? You were correct. We're going to put some more resources towards dealing with students and the incredible amount of pressure that they're under to perform. But I couldn't help but beam with pride as I wrote back to this, and this young lady and many others who wrote me. And I hope that this is just their first step in their political activism, and that they would continue to make their voice heard, because their voice is what's going to make the future of these islands. However, the graduation of our students should never be politicized. I mean, there's no place else where the governor gets involved with who's graduating, how their graduation. It is too important to reduce these situations to pleasing the public and curry-favoring votes by making it look like you're doing something towards the cause. Now, I really spent the last weekend, it's widely held in the public that I was on vacation. I was not on vacation. I went away for the weekend. I didn't take any days off. I was back to work Monday. Recruiting staff to come to the Virgin Islands, specifically St. Croix, and businesses that we needed to talk to on the mainland. And while I was doing that, I was dealing with the health situation and the graduation. It was an extremely tough week for us, especially for Lieutenant Governor Roach, who was acting governor at the time. But it allowed me some time, and because I was getting the calls too from very concerned parents, senators, good friends, supporters, Albert, what are you going to do? And I looked at this from many different vantage points, how I would feel as a student if, after all this time, how I felt 30-something years ago when I graduated. And as a parent, when I was going through last year, having to do the virtual graduation and not being able to celebrate the way we want to for our kids. And yes, as a governor and overlooking everything and knowing that, yes, this is one situation among many situations that you've had to make decisions, and this affects 110,000 people, because one COVID-positive person could do ultimate damage. And while I acknowledge that the decisions that we have made over the last year, to some may have been unpopular, but everything can be about politics in the Virgin Islands. And the reason why we have succeeded and we have that positivity rate that is 1 point something, and we're down to 63 people in the territory, almost like 4 or 5 people on St. Croix, and the whole of St. Croix. The reason we have done that is because we've been able to make tough decisions and face adversity. And that's a lesson I really want the students to come away with, that adversity is what makes you stronger. Steel sharpens steel every time. But this issue is about protecting the health and the safety of our entire population, the students, their families, and the faculty and staff at our schools, while finding a way to celebrate our graduates that we are so proud of. As such, I have charged my Department of Education team to ensure that for every graduate in the Virgin Islands, they get an opportunity to walk across that stage. And for every graduate in the Virgin Islands, that their parents are present. Not one, but their both parents are present, and they get an opportunity to walk across that stage. It's important to them, and it's important to me. So every parent will be able to have that experience. It's going to be carried out in different ways. Some have drive-through graduations, some are walk-through graduations. I attended one today. Beautiful. Everybody was safe, mask on, people were able to depart. It was all outdoors, no threat of this. It is a proud moment when you walk across that stage. And it means a lot to a student, but it means incredible amount to the parents that raised them, that saw that little baby come through those delivery doors 18, 19 years ago. Now, what we're doing this year, understand, it's a compromise. We always have to compromise in this fight against COVID. From a totally virtual event to an event now where we have the graduates participating. A step forward, yes, but we have a long way to go. You know, I was in Knoxville and Miami last week, and people are moving about like the COVID and the pandemic is done. Well, it might be done for them, but it's not done here in the territory, where we're going to continue to do what we have done and lead in the pack in keeping our people safe. We're getting there, you know, slowly but surely, but we're not there yet. We look forward to next school year, and everybody who is a junior now and their parents being able to walk across that stage, sit in that graduation floor, be able to witness that. It is unfortunate we couldn't deliver that type of graduation. The Virgin Islanders known for complete with the horns. You know, I just love them. But if we continue to vaccinate, to get vaccinated, and practice our social distancing, we're going to get to that normalcy quicker while keeping our community safe as much as possible. Congratulations to all my beautiful young people, and much love and congratulations to the graduates and their parents and family. In closing this afternoon, I want to say a shout out to my Public Works team. It is National Public Works Week, and I want to take this opportunity to thank first the working men and women of Public Works. It's not easy, you know. Once the rain comes, the grass growing, there are always potholes, things getting torn up, people throwing down trash, guts have to be cleaned, people have to be taken care of, cars have to be moved. It's not easy. And these people get up every single day and they're out there trying to make sure that we're good to go. I also want to say congratulations and happy Public Works Week to our designee, Derek Gabriel. He's taken off with a really good start, trying to get things under control there. But to the entire team, please, please keep working on our roads, keeping the grass cut, the buses running, traffic signals working, and everything else that you're doing that people sometimes don't notice, but we notice, and we want to say thank you. Lastly, before I leave this afternoon, I would be too remiss if I didn't extend congratulations for the man himself, from his humble beginnings on a quiet road in Catherine's Rest to becoming the greatest power forward to ever play basketball in the world, our very own Tim Duncan. He was inducted into the National Basketball Hall of Fame this weekend, and Timmy was an all-star and MVP on the court for his entire career, but he is an MVP off the court as well. Aside from his philanthropic contributions in the immediate aftermath of the storm, he has and continues to give to our community without fanfare. This is what you call a stand-up international Virgin Islands icon. I had the privilege of playing basketball against him much in my younger years when my knees were more spry. And I could always say, he never, and in those of you who play basketball, know how much cussing goes on and complaining goes on the court. He never balled. I always play to his heart. I also want to give a shout out to my good friend and ESPN reporter, Mark J. Spears, for interviewing me while I was in the States and putting out a nice complimentary article on Tim Duncan and celebrating his incredible career as a basketball player and as a human being and a Virgin Islanders. Thank you all. I'm available to the press. Congratulations again, Timmy, and all of us here in the Virgin Islands are beaming with pride. We got some questions from the press. We'll take those now. Get Lasiba Knight here in studio from the St. Croix Avis. Good afternoon, Lasiba.
Hello, good afternoon. How are we doing today?
Good, sir, good.
Awesome. So I have two questions, just a little bit off topic, but I was wondering if I can get an update on the ongoing negotiations with the horse racing situation, Southland government.
Both of our negotiations with horse racing are completed for the most part at this time. We're just letting the lawyers do the work. We should have an announcement for you soon. We were trying to wait to make both announcements at the same time, but we're going to announce St. Croix and then we'll announce St. Thomas at a later date.
Okay, thank you.
You're going to like it.
Awesome. And then with the EPA shutting down Lime Tree, hitting them with a 60-day ban on production, I have a question. Is DPNR able to effectively regulate Lime Tree? It's come to light that in the days and weeks and months before the EPA got here, our air monitoring situation was not ideal. We didn't have certain, 5 towers in place. And if DPNR is not currently able to effectively regulate Lime Tree, what specific things does the agency need beefed up?
So I'd like to say, and thank you for that question, Lasiba. I've been very careful with this issue, making sure that we don't accuse anybody until we have concrete proof of what's going on. Residents continue to complain about nauseous feeling, and the refinery has been shut down since last week. So that is of real bothersome to us because our goal here is to find out what the problem is. The other thing that I'd like to remind people is the refinery is half the size, or probably a third of the size that it was over the last 50 years of its existence. And it was equally monitored by DPNR and EPA alike. We have EPA officials that work for people who work on behalf of the EPA in DPNR. We have been working on the consent decree from before I got in office. There were enough meetings, and they continue to go on in terms of getting that signed, plus other air permitting issues. So we're going to continue to monitor it. We think that we have the right things in place. We may need additional equipment, but right now we have, I think, 2 of the EPA sites for air monitoring are now in operation, and there's another 3 that they're working on getting up as we speak to figure out what is the source of this. I have been, as I said, I have had, last week, we spoke to the refinery managers several times, their attorneys, working with them to figure out where this stench is coming from. And we have not established that it is coming from the Lime Tree facility. It's a likely culprit, but we have other industrial situations that are on the island. So my goal now is to find out where this stench is coming from to make sure that our people stay safe. And I'm really worried about the fact that what you could smell is good, but what you can't smell may be worse. So we want to make sure that everything that's going on is making sure that we keep our people safe first. After my discussions with them last week, they agreed to shut down the refinery. So we'll see now if the scent disappears or if it continues to remain and there is some other source causing that.
And I just wanted to pick up on something. Has the administration been getting continued calls even after the shutdown in production?
Yes.
Do you have a number for those?
No, a number for the amount of complaints? I don't have it offhand, but we also do remember we monitor the COVID call every morning. So one of the things we're also monitoring the call for is any complaints about noxious smells. And we had an individual report to the hospital, I think last night or over the weekend, with the same complaint. So it even makes us more concerned now, like we need to find where this thing is coming from.
Okay. Thank you very much.
Thank you, Lasiba. Go ahead on the phone. Hello? They can hear me now? You want to take the other person? There was two. You go ahead. I can hear you. Go ahead. Yeah, for some reason we're having problems with our audio. Give us a second here. Let's see if we can straighten this out. Go ahead. Something's going on with the audio. I think I hear something. Good afternoon. Yeah, we can hear you now. Go ahead.
Thank you. I think Susan could have heard you as well. I think she heard you as well, but anyway, hopefully she calls back. A few questions, Governor. The first one is on the child tax credit there.
Right.
I think the Biden administration, I think this month, is going to start distributing up to $300 a month per child for the child tax credit. I was wondering whether the territory is included in that and whether families should know about that. I think it kicks off on July 15th. And if so, who's going to be administering it? Is it the BIR? So if you could give some clarification on that.
Yes, sir. The territories were included. Those payments are supposed to start in July. What we're thinking about is doing group payments, so we either pay it all one time or half and half, but we're trying to stay away from paying it by monthly.
Okay. Can't really hear you clearly, but you're saying we are included and those payments have to go out. Are they going out from BIR?
Say that for him, Richard. What did he say?
He said, are they going to be coming through BIR?
Yes, they'll be coming through the Bureau of Internal Revenue, sir.
Okay. Thanks, Governor. Governor, I want to follow up on I want to ask on the graduation situation there. Of course, you had a lengthy talk congratulating the students and why you feel like, the current setups that they have, walkthroughs and drive-throughs, are the best options. What would you say to folks who would tell you that this is being done safely across the U.S., a number of jurisdictions, countless schools are doing seated, in-person graduation affairs, deeming it important to students. In fact, some institutions have gone as far as inviting 2020 students to participate in this year's seated events because they felt like those students missed out on one of the most important memories of their lives. What would you say to folks who would say to you, well, God, it is being done in the States, on the mainland, why can't we do it here?
To that, I would say that, very passionately that, it isn't about the students alone. And while I understand the significance of that, we must understand that those places that are having those type of graduations, they got 6 hospitals. They could drive up the road and carry their sick people someplace. Those people have the ability to 10 times, 20 times the resources that we have here. When I think about our students, we try to make sure that people get safe. When we look at who is getting vaccinated in our community, we have to pay attention to the lower economic strata is less likely to get vaccinated. That's where we're having our hardest time convincing people. And, that's exactly where the target group that is going to be going to some of these graduations. We have a 30% poverty rate in the Virgin Islands, unfortunately. So I understand. I mean, the gut part of me, it goes back to the old adage, like my mom used to say, if your friend them run over the cliff, you're going to run over the cliff too. But in reality, it's like we're just trying to be, when we started on this, it was all virtual. I could be very honest with you. I was like, we're going to have all virtual. The Department of Education convinced me that they could do walk across safely, and that's why it is done this way, especially in St. Thomas, where we have almost 20 times the cases that we have in St. Croix.